Hey everyone, it's Devin with Rehab Dynamics. I wanted to talk to y'all today about 10 ways to improve your recovery after surgery. We have a lot of people here, of course, post-op from surgeries, usually things like knee replacements, hip replacements, spine surgery, shoulder surgery, all of those things. And I wanted to talk a little bit about ways that you can help yourself recover better and recover faster and maintain your health while you're getting better from surgery. So the first thing to do is follow your doctor's instructions. So if he tells you don't take baths yet, only showers, listen to him or her. That's really important. If they say don't go swimming, abide by that. Or maybe you shouldn't be lifting more than 5 pounds or 10 pounds. Listen to all those things. Sometimes they sound silly, but they tell you to do those things for a reason. So definitely listen to your doctor's instructions. Next, keep your follow-up appointments with your doctor. Sometimes after you start to feel better and you think that things are healing, it seems also kind of unnecessary to go back and see them, but many times they're looking for things that you aren't. They can help look for signs of infection. They can also do things that you aren't able to do, like blood work. They can make sure that the procedure that was done effectively treated the problem that you had, and they can just make sure overall that you're healthy and things are looking good. Next, try to prevent infection. The best way to do that is by keeping your hands washed anytime you're dealing with the incisions you might have. If you're doing a dressing change or you're just inspecting it for infection, just make sure that you are clean about it and that you follow all of your wound care instructions. Next, it would be inspect your incision. Now, sometimes people don't like to do that. It kind of grosses them out to look at wounds, especially on their own body, but it's very important. And you can look for signs of infection. That might be something like redness or pinkness of the incision, drainage. Look at the color of the drainage. Maybe sometimes there's an odor. Sometimes it's kind of like a yellow or foggy, cloudy drainage that you need to be aware of. Also, how are the staples or stitches looking? Is the wound closing or any parts open and gapping? That's some important things to look for. Number 5 would be to eat and drink properly. Lots of times people don't have an appetite after surgery. They have some nausea from anesthesia and they just don't really feel like eating or drinking, but it's of course very important to eat to maintain your energy and to be able to heal. And also staying hydrated is of course very, very important, especially people get constipated after surgery because of the anesthesia and because of any pain medicine they might be taking. So you need to be drinking plenty of fluids to help with that. And then also number 6, go to physical therapy consistently. Same thing, even if you feel like you are feeling better and that your pain is less, just because your pain is better doesn't mean you're fully recovered. Lots of time after your pain subsides, you still need to work on range of motion and strength and also scar mobility, just to make sure you go back to full function and that you don't have an increased risk of re-injury. So even if you're feeling better, finish your entire prescribed plan of care for physical therapy, because just because you feel better doesn't mean you're fully recovered. That's something to keep in mind. Number 7, care for your incision the right way. Sometimes people try to over clean their incision and they start putting on rubbing alcohol or peroxide onto their incision, which is a little bit too much lots of times. So they start picking at the scabs to try to clean it up and it kind of reopens some wound areas to infection. So really all you need to do for your incision is just use some gentle soap and water. You don't have to scrub at it, but just gentle. And usually your doctor should send you wound care instructions and follow those, but care for your wound the right way that's instructed. Don't be too aggressive with it. Also, number 8, know when to go to the ER. If you really are having a lot of increased pain that you can't control, maybe you're running a fever, you're having a hard time keeping down food and water, you're nauseated, you're having trouble breathing, you're bleeding from your incision, those are all reasons to either go see your surgeon or your primary care physician, or if they're not available, get yourself to the ER. It's important. So know when to go, really get some help if you feel like it's an emergent situation. Don't be afraid to go, make an appointment as quick as you can. Number 9, control your pain. You want to keep your pain at a tolerable level. Sometimes people don't like to take their pain medicine because they either don't like how it makes them feel, or they think they might get addicted to it, or they're just trying to be, tough and feel like, that they don't need to take pain medicine. But really, it's important to take it in correct dosages as prescribed, just to help control your pain and keep it at a level that's, again, tolerable. That'll help keep you moving, which will help speed your healing process and your recovery. If you're able to move and do more, you'll recover better than being so, immobilized by your level of pain. And then number 10, get moving. So walking, if possible, depending on what you've had done, is one of the best things you can do after surgery. It'll help with your blood flow in your legs, which means you'll have a decreased risk of a DVT or a blood clot in your leg. So some good low-level, moderate walking is really good to help with your blood flow, with your breathing, with your lungs, all that good stuff. So definitely keep moving. Don't just stay in bed all day unless there's a good reason for that, unless that was instructed by your doctor. All right, so that's our top 10 ways to recover from surgery. That's follow your doctor's instructions, keep your follow-up appointments, prevent infection, inspect your incision, drink and eat properly, go to physical therapy consistently, care for your incision the right way, know when to see your doctor or go to the ER, control your pain, and get moving.